Hello friends, let's discuss some routes of administration. So basically the selection of the route of administration depends on the properties of the drug, for example the solubilities and ionization or some other properties, and on the therapeutic objectives, like either we want to restrict the action of the drug to the local area, or we need a long-term administration, or either we need a rapid onset of action. So major route of administrations have been classified into enteral and parenteral route. There are some other routes as well, which may be inhalation, intranasal, intrathecal, topical, dermal, or maybe the rectal route. So let's discuss the first enteral route, which has been further classified into sublingual and oral route. So we will discuss some of the benefits as well as some of the disadvantages of all these routes. And the most commonly used route of administration is the oral route, where the drug administered to the oral cavity. The major advantages of using the oral cavity is that the oral drugs are easily and self-administered. It is the pain-free route of administration, is the most convenient, and the major benefits of using the oral route are they limit the systemic infection that could complicate the treatment, and the overdoses or the toxicities of the drug can also be overcome by using some of the antidotes like activated charcoal. The drug that are administered to the oral route may face the harsh environment of the stomach, where the acidic pH may destroy the drug. So for that purpose we use enteric coated medicine that protect the drug or active ingredient from the harsh environment of the GAT, and depending on the formulation, the release of the drug may be prolonged, producing a sustained release effect. So some drug absorbed from the stomach, while the major organ in the GIT for the absorption of the drug is duodenum, where the presence of the ileum increases the surface area of the duodenum and ultimately increases the absorption of the drug. The drugs that absorb from the GIT, they enter the portal circulations, and where they encounter the liver before they are distributed into the different compartments of the body. These drugs undergo the first pass metabolism in the liver and extensively metabolize before entering the systemic circulation. So the first pass metabolism by the intestine or liver decreases the efficacy of the drug. So therefore those drugs which are given by oral route must be given in sufficient quantity in order to ensure that enough of the active ingredient reaches the organ and produces its therapeutic effect. So another enteral route of administration is a sublingual route, where the drug is placed under the tongue, and from where the drug diffuses directly into the network of the capillaries, from where it enters into the systemic circulation. So the benefits of using the sublingual route of administration is that it is a convenient method of administration of the drug. The drug will be protected from the GIT harsh environment. There will be low chances of infections, and there will be the rapid absorption of the drug, because the drug directly enters into the systemic circulation, so it produces its rapid effect. And the drug will also be protected from the first pass metabolism by using this route of administration. In the parenteral route of administration, the drugs are introduced directly into the systemic circulation across the body barrier's defenses. So parenteral administration is supposed to be used for those drugs which are unstable in GIT or which have poor absorption from the GIT. This parenteral route of administration is also used for those patients who are unconscious, unable to use the drug through the oral or sublingual routes. The major benefits of using the parenteral route of administration are that the drugs protected from the GIT harsh environment. Secondly, the drug also protected from the first pass metabolism, and the third one is that the bioavailability of the drug using this route of administration is the highest one. So the disadvantages of using the parenteral route of administration are that this is irreversible, and it may cause pain, fear, and as well as the infection chances may also be increased. IV route is the most commonly used route of administration among all the parenteral routes. This is used for those drugs which are not orally absorbed or when there is no other choice. While using the IV route, the drugs avoid the GIT encounters, and in this way by first pass metabolism. So the benefits of using IV route are they produces a rapid onset, and they have a maximum degree of control over the circulating levels of the drugs. But the disadvantage of using the IV routes are the drug cannot be recalled, like the overdoses and toxicities cannot be overcome. It may cause hemolysis or some other adverse reaction by the too rapid delivery of the drugs and too high concentrations of the drug in the plasma and tissues. So therefore, the rate of infusions must be carefully controlled. So the second parenteral route of administration is the intramuscular. The drugs that are administered through the intramuscular route can be aqueous solutions or maybe the depot preparations. Most oftenly, the suspension of the drug in a non-aqueous vehicle such as polyethylene glycol. So the absorption of the drug in an aqueous solution is faster as compared to the depot preparations. So the vehicle diffuses out of the muscles and the drug precipitate at the site of the injection. So the drug then diffuses out into the circulation in a very slow and sustained manner over an extended period of time. While discussing the subcutaneous route, this route also required the absorption as that of the intramuscular injection, but the rate of absorption is slower as that of the IV route. It also decreases some of the risk associated with the intravenous injections. The examples of the drugs that are administered using this route are the contraceptives that are implanted for the long-term activity, and some programmable mechanical pumps that can be implanted to deliver the insulin in diabetic patients. So among the other route of administration, let's discuss the first one, that is inhalation. This route of administration provides a rapid delivery of the drug across the large surface area of the mucous membranes of the respiratory tract and pulmonary epithelium. So this produces as rapid effect as that of the IV injections. The route of administration is used especially for those drugs which are in the form of gases or that can be delivered in aerosol forms. The route is very effective and convenient for those patients who have some respiratory disorders such as asthma or some chronic obstructive pulmonary disease. This route provides the drug directly into the systemic circulation, and in this way the side effects are also minimized. Intranasal route of administration involves the direct delivery of the drug into the nose. Most commonly, the decongestants are used through this route. Some of the drugs are intended to directly administered into the cerebrospinal fluid, and for that purpose we use the intrathecal route. While discussing the topical route, as the name indicates, in this the drugs are applied topically to the skin for their local effect. For example, some of the antifungals and antibacterials are topically applied to the skin. The next one is the transdermal route, where the drugs are applied to the skin usually through the transdermal patches, and this route of administration achieves a systemic effect. So the drug that directly reaches into the circulation depends on the physical properties of the skin as well as the blood circulation to the site of the application. So this route is most oftenly used for the sustained delivery of the drugs. The last route is the rectal route of administration, and 50% of the drainage of the rectal region bypasses the first pass metabolism, and in this way the drug is protected from the biotransformation through the liver. Like the sublingual route of administration, the advantages of the rectal route are the same, like the drug protected from the gastric manipulations, and it also protected from the first pass metabolism, as we discussed earlier. And the rectal route is useful for those drugs which cause vomiting when they are administered orally or when the patients are unconscious. But the disadvantage of using the rectal route of administration is that many drugs irritate the rectal mucosa. So this was all about the route of administrations.